As a physician, former hospital administrator, and health insurance executive, acupuncturist, and healthcare consultant, I feel I've looked at clouds from both sides now. I was the New York City ER doc trying to keep you out of the hospital, and the hospital administrator trying to admit you. I feel compelled to jump into the fray and counter some of the myths surrounding our health and what the future may hold for us. While talking with a Beijing hospital administrator on a recent trip to China, I learned that the successful Chinese doctor is the one with the fewest sick patients. Imagine that in America. Chinese physicians are focused on keeping their patients well and out of the hospital. What is our focus? The state of your health is in your hands, not the government, not the doctors and hospitals, not the insurance companies. We must stop focusing on what happens when I get sick and start focusing on how can I improve my health and well-being. We are a country of overeaters. Too many of us smoke, eat junk food, and never exercise. We sit around worrying about our health and what disease we might die from instead of planning how we can improve our own lives. So, to all the no socialist medicine folks, the healthcare reform now folks, the national health system folks, and even the die government die folks, let's stop shouting at each other and look at ourselves honestly. Why are we in this mess? We are not focused on health and wellness. We are focused on illness and disease. Until we begin to eat what our body needs, exercise regularly, and stop smoking and overeating, and start concentrating on our mental and physical health, no insurance or healthcare reform will change the path of escalating cost, over-testing, over-prescribing, and over-stressing that we are now on. If we weren't constantly chasing the tail of chronic illness, the cost of insuring everyone against catastrophic illness would not be an issue. Recently, I heard Dr. Andrew Weil suggest on Larry King that the retraining of physicians to provide low-tech interventions to treat common illnesses instead of expensive tests and pharmaceuticals that do not improve the outcome would make a huge difference. I applaud such thinking. Let's save the high-tech, high-cost drugs and treatments for when they are really needed so that we can afford to provide them for many people for a lot longer. Please stay tuned as I will discuss some common misconceptions about the following: prevention and wellness as alternatives to fighting disease and illness, and what your health insurance company is really doing with your money. I'm Dr. Cynthia Ambrose with Health Now New York, helping you get your facts and your health straight. Please feel free to post your text or video responses, and visit us on Facebook and Twitter. Yours in good health.